Hi, everybody. Today we are going to talk about thought records, which are great tools to use during CBT, cognitive behavioral therapy. Let's see. Thought records, what are they? They are a tool that can be used by anybody really to help individuals identify and recognize any sort of distortions with their thoughts or to evaluate negative thoughts when they come up. Sometimes we call them automatic thoughts, which are thoughts that come up immediately within maybe 3 to 5 seconds, just an automatic jump to conclusion thought. As clinicians, we use thought records to assist with collaborating with patients, to kind of help them, like I mentioned, identify their cognitive distortions or biases during their thought processes that they may not see on their own. These thought records can be used for almost any situation and consist of several columns, which we will go into. The first column would describe the situation. Second column would describe your thoughts. Third would be the resulting emotions and behaviors that come along with the situation. And finally, a column to reevaluate and put in alternate thoughts. So we'll go through those. When it comes to the situation, this column describes a specific situation that's occurring that is triggering the negative effect or thought, and what is giving you the feelings that you're feeling immediately. Next column, like we mentioned, thoughts. This column contains the automatic thoughts, which immediately come to mind within seconds of the situation. These are in response to the triggered situation. Third column, emotions. Emotions, this column records what you are feeling in response to these automatic thoughts or beliefs that come up. And finally, the behaviors is a description column that you would put down any behaviors that are resulting from these thoughts or emotions, such as the actions that you're taking, your avoidance behaviors or physical symptoms, things like that. And then alternative thoughts, this final column will encourage you to reevaluate the initial situation, the initial thought, and see if you can come up with generating alternative thoughts that are more balanced and possibly more realistic to the situation. Once all these automatic thoughts have been identified, then we can go through what we call challenging the thoughts. And this can be done by answering following questions to assess the validity of the thoughts. Some of these questions would include, is there substantial evidence to support my thought? Is there any contrary evidence to my thoughts? How about, am I using all the evidence to interpret the situation, or am I just solely focusing in on the one negative piece of it? What would a friend think about this thought? If somebody else was having it, how would they feel? Would they have the same negative emotion as you do? How can looking at the situation positively make it have a different outcome? And finally, will this situation matter to you in 5 years from now? Sometimes I do even, will it matter in 5 minutes? Will it matter in 5 days? Will it matter in 5 weeks, 5 months, 5 years? You can do it kind of any way that you want. And then you can examine the evidence by challenging these core beliefs. And these core beliefs can be, for an example, if, you feel like nobody likes me. And then you're going to look at the information that supports that belief. My friend didn't answer my call. The cashier at the grocery store was unfriendly. My boss gave me negative feedback at work. And then you're going to look at information that doesn't support that. I was invited to a coworker's birthday party, so that goes against everybody hating me. Customers at my job always seem happy to talk with me. Again, that is the opposite of your initial beliefs. My friend called to check in when I was sick. Again, those are contrary to your initial automatic thoughts. And then you can look at them modified or, again, as an alternative. I was asked on a date, but it must have been out of pity. See, you're doing that again. You're going back to the automatic thoughts. I'm close with my parents, but they're my parents, so they don't count. Again, want to relook at that and try to find a different way to view it. My friend gave me a birthday present, but only because I gave them one. Again, you're letting those negative thoughts and automatic thoughts come in and distort the view of, the situation. Let's see. Core beliefs, again, they're a person's central ideas about themselves and how they view the world. And everybody has different core beliefs. They're made up of how, it's used as it's like a lens that you that you view the world as. Again, not everybody views it the same. Every individual has different life experiences, which give them different lenses that they view the world with. The final step after examining all the evidence is to look into ways how to reframe them, with a couple of examples on ways to untwist your thoughts or examine them would be identify the distortion. This could be writing down negative thoughts so you can see which of the negative distortions you're involved in. This makes it easier to see the problem in a more positive and more realistic way. Examining the evidence instead of assuming that your negative thoughts is entirely true. Examine it. If you feel that you never do anything right, you could list several things that you have done successfully. The goal is to kind of get your mind frame out of that negative area. You could do what they call the double standard method. Instead of putting yourself down in a harsh way, condemning way, talk to yourself in the same compassionate way that you would talk to somebody else, a friend, somebody you care for, someone you love. The experimental technique is another way. This method sounds a little drab, but it can be illuminating. Instead of thinking about your problems in an all or nothing extreme, you can evaluate them on a scale of 1 to 10. When things don't work out as you hoped, think about the experience as a partial success rather than a complete failure. This will give you the opportunity to learn from the situation. Thinking in shades of gray. This is also seeing what you can learn from the situation, and it's not all or nothing. The survey method, asking people questions to find out if your thoughts and attitudes are realistic. You may view it one way, and again, somebody else has a different lens. So maybe bounce the idea off of them. Hey, am I overreacting? Is this something that you think you may feel the same way about if it happened to you? Define method, define terms. When you're labeling yourself such as inferior or a fool or a loser, ask, what's the definition of a fool? What's the definition of a loser? You'll feel better when you see that there is no such thing as a fool or a loser. Semantic method, substituting language that is less colorful and emotionally loaded. And this method's helpful for should statements. Instead of telling yourself, I shouldn't have made that mistake, you can turn it around and say, it'd be better if I had not made that mistake. Again, you're retraining your brain to look at the situations differently. Reattribution, instead of automatically assuming that you're bad and blaming yourself entirely for a problem, think about the many factors that have contributed to it. Focusing on solving the problem instead of using up all your energy and blaming yourself and feeling guilty. And then there's the cost benefit analysis, which is listing the advantages and disadvantages of a feeling. Like getting angry when your plane is late is a negative thought. No matter how hard I try, I always screw up. Or a behavior pattern like overeating and lying in bed when you're depressed. You can also use the cost-benefit analysis to modify a self-defeating belief, such as, I really need to always try to be perfect. Again, it takes time, and it takes working together. Again, bouncing ideas off of people, and working with the therapist was helpful. So for the next session, I would have the patient complete the thought record, and then and the core belief worksheet as well. And together we can examine the responses that the patient came up with, and work on them together to identify which core beliefs continue to come up and which ways we can modify those if needed, and make them a more realistic alternative way to view the situation in a healthier way. So that is basically the summation of using a thought record, and I wish you guys good luck, and that is it for me. Take care.